Hi guys, welcome back to my channel. My name is Cristina, and in today's video I'm going to be talking more about what is going on in my life right now, which is my facial paralysis. I was diagnosed with Bell's palsy, and for those that are new and don't know what Bell's palsy is, I didn't know before I actually was diagnosed with it. And basically is a facial paralysis or partial facial paralysis on my in my situation. Everything started because I got a wisdom tooth extraction and my nerves were bruised, and because it was bruised and it was inflamed, the inflammation kind of pinched other nerves that crisscross each other in my face. That's more or less I could explain it. And basically because it's pinched, it's causing it to not send any sensory, it's not letting the brain know that I want to move this part of my face. So even though at this point I'm not asleep, I know a lot of people, different people experience different things. I've read online that some people experience twitching. I don't experience any twitching. I am not in any pain. I feel my face as normal. Like if I wouldn't be looking in the mirror, I would think I'm talking normal. I haven't lost any sense on my tongue. Everything really tastes the same. That's basically a quick rundown of what's going on with me. I do apologize for the up close and personal. It's been a week since I had my wisdom extraction on day 7, and this is how my face looks. On the first 2 days it was fine. On the 3rd day I remember taking a shower and my eye, like water going into my eye, and I couldn't understand it, but I went to sleep because it was late at night. I didn't even bother to look at my face in the mirror. Then the following day I had to go into the office, and when I went to the office it was normal. Again, I brushed my teeth in a rush. I wasn't really looking at my face, and especially because I go in at 6 o'clock in the morning. I remember trying to apply chapstick and my lips felt weird, and then I asked my friend, like, do I look weird to you? And then she was like, yeah, your lip is kind of going sideways when you talk, and your eye is, you kind of have like a lazy eye on the area where you, on your right side of your face basically, which was the side of the wisdom extraction. So when I went to the office and I noticed that my face was like this, that was on Tuesday. Right after work at 2:30 I went straight to the dentist so they can take a second look. I called them up and they told me that they can take me as a walk-in. They didn't charge me or anything. They just wanted to see how my face was doing and how my wisdom tooth hole was doing, and the hole was doing fine. I was feeling fine. I mean, I wouldn't describe that the wisdom tooth has been such a pain. I mean, I only took 1 out. I know people that have taken 4 at the same time, so that wasn't in the worst pain. I was just taking Tylenol at night. I'm still taking my antibiotics. They took an x-ray on that day, and they told me that it just looks like my nerves are kind of bruised, but nothing out of the ordinary, and that this should die down. But a week later, 7 days later, and I'm still looking like this. I just and in today's video I want to be sharing with you guys the treatment that I am following to get rid of this paralysis. When I had my wisdom tooth extracted, they prescribed amoxicillin, the 500 milligram. I'm taking it 3 times a day. So that's the first thing, which is the antibiotics. I'm almost done on that medication. And then once I was diagnosed with the paralysis, with Bell's palsy, I was given prednisone, which basically is a steroid, and then valacyclovir. I don't know, I'm gonna put it in the screen, but basically this one is an antiviral drug and this one is a steroid. So basically the steroid is usually used on patients that have inflammation, such as like asthma patients and patients that have Bell's palsy. So I've only been taking these medications for 2 days now, so we'll see. I do feel that, and maybe this is me because I'm getting comfortable in how I'm feeling, but I feel like my eyes are not as hard to blink. I felt like my eyes were kind of swollen prior to taking the steroids, so I feel like the eyes are the first thing that I'm kind of noticing a difference. I haven't talked about how it's affecting me. Basically, with this paralysis, I'm having difficulty blinking my right eye. So like sometimes I'll blink this eye and then this eye will just stay open. So, or it's like it has like a delay. Also some parts of my nostrils, when I breathe in, that's when you can really see. But if I'm like speaking to you guys like this, you can barely see the nostrils difference. At least I don't think so. And then the biggest thing also is my mouth. When I'm speaking very monotone, you can barely see it. So when I'm talking very animated, that's when you guys can really tell that something's wrong with me. So let me show you guys. So when I smile, I'm trying to smile from ear to ear, but this is all I could do. If I show my teeth, so that's like the biggest thing right now, and kind of like my mouth is going sideways when I speak, depending on the letters I pronounce. Pronouncing the letter M, P, B, those letters is kind of like those that cause my lips to go sideways. But yep, so anyway, so that's part one of the medication. They also prescribed, not prescribing, but they advised me to buy some eye drops for my eyes. So that's what I did that. Do it 3, 4, 5 times as needed. They also told me like if I'm cleaning not to have the fan on, if I'm outside to wear sunglasses, and if possible wear patches, especially that we're now in the middle of the pandemic. I really barely go out. So that's that. As far as massages, this is the massages that I'm doing. I'm trying to bring my eyebrows, start from the top of my face all the way to the bottom of it, and basically what you're trying to do is kind of force the other side that is paralyzed to kind of mimic what the left side is doing. So the first thing that they want me to do, raise my brows. So I will go like this 10 times alone, and then I'll do another 10 with me helping my eyebrows up. So it's kind of waking up the nerve. So I do that 10 times. Then I also do it here. I'll try to do my, you have to open up your nostrils 10 times. Then I also try to do a sad face. I do it 10 times without any assistance, and then the same thing. And then last but not least, use my palm of my hand and massage my whole area. So that's basically, oh, one more thing I've been using, where is it? Let me go get it. Right after the shower, I use this little roller thing. This, what is it called? This face roller is a lifesaver. I roll it all around my face and then just focus it on one side where the paralysis is, and I feel like it relaxes me. It's very soothing. So if you don't have one of these, I highly recommend you grabbing one. It says that it stimulates your nerves and it reduces inflammation. Don't know if that's true, but I'll keep you guys posted on my journey. One of the things that they want to mention with my medication, I was very depressed because, as you guys know, going through something like this, it's not easy. From one day to another, having your face look like this, it could be very traumatic and very depressing again. But taking these steroids, one of the side effects, other than it makes you gain weight, it boosts your energy and it makes you feel happy. So once I started drinking or taking these pills, I am so much stronger. I am so much positive. I am so much more hopeful that this is just gonna pass, and it's a matter of time. As studies have shown, the paralysis can last in patients 2 to 6 weeks. So I'm hoping that by the 2 weeks this is over. I will keep you guys posted, and just be hopeful, guys. With that being said, thank you so much for watching my video, and I will see you all in my next video. Bye, guys.